Hello, good morning, everyone. I'm Dr. Rohan Krishnan, and we are watching Health Perspective presented by Medical Dialogues. So, in today's era, the national government is running a lot of program for various communicable and non-communicable diseases. But the most important one, which draws our attention today, is the National Tuberculosis Elimination Program. Recently, the government of India has notified and has said in the parliament that it is planning to eliminate and eradicate TB completely by the year 2025. To discuss on this topic, I have with me one of the very renowned medical field professional, Dr. Professor Jugal Kishore sir, who is director and professor of Vardhaman Medical College and Safdarjung Hospital in the Department of Community Medicine, and has been up in the field and watching all these activities of the various government from a very long time. I very well welcome you, sir, to our program. Thank you for giving us time from your busy schedule and giving us time. Very well, welcome, sir. Now you have opened your camera, and now we are lucky to have you, sir. Today we are going to
Yeah,
discuss about the National TB Eradication Program. The government of India has now said that it is planning to eliminate TB by the year 2025, and it has actually the National Strategic Plan, which they have given, is the DTPB plan, that is Detect, Treat, Prevent, Build plan. So sir, we wanted your views on this topic. क्या है सर ये प्रोग्राम, क्या लोग, क्या इसमें, व्हाट आर वी एक्सपेक्टिंग, क्या है इसका सर नटशेल में?
Dr. Roshan, good morning, and good
Good
morning to
morning.
everybody. First of all, tell me that I should speak in English or Hindi. किस पे
सर
बात करूं?
बोथ इज
मेरा नाम आपने डॉक्टर जुगल किशोर हिंदी में दिया हुआ है. Okay. Who are the viewers? Are they going to like general
sir,
public or?
the viewers are 3 lakhs doctors who of the community of the medical field pan India, who are registered with the medical dialogues, and to all those who
Okay,
will we will be sharing.
okay, fine. Roshan, you rightly said that the TB, is a concern to the government, and it is rightly should be a concern. It is a very old disease and created havoc to the world in many of the times. Centuries had witnessed that how humankind is suffering from different names like caries or sharog or whatever you can say. TB is always a big issue, and fortunately, what we are seeing in other countries like developed nations, the TB has gone down, but it is still a problem for Southeast Asia region and Africa. And after the invent of HIV, it has become again the center stage when we talk about. Still, the people are dying, and a big number of people are dying, and every year, huge number of people getting it, and they slide into the poverty. Uh, the story goes back to 1962 when the TB program was started as National TB Control Program. So we have a long history, and it was started with that we should detect as early as possible and put them on treatment, whatever treatment was available. And then also preventive component was also there, giving the BCG vaccination. Uh, but somehow, somewhere, the TB was delivered by the district TB centers, and they were developed in various district of the country. But it was not picking up. The reason were many, uh, and the reason was that we had only the few drugs, and the drugs used to be taken in a large quantity, like the PAS and INH. But the rifampicin came in 1983 and 84 onward. Then it was associated with this multi-drug treatment, and that was started. Still, the rifampicin and INH was the cornerstone for the TB, but somehow, the practical issues were that once you start the treatment, it was found that it was not completed. So the compliance was poor, and the reasons are already known now. But when we talk about 40 years back, then issues were different. And interestingly, what is found that half of the patients were not coming forward to the diagnosis, and the diagnostic facilities were less. Only the X-rays used to be the main mode of diagnosis, which was not very sensitive and specific system of diagnosis. And because of that, not every patient uh, got detected rightly and put on treatment. And then once any TB patients got leave of their symptoms, they used to leave it. And it was a domiciliary treatment, although domiciliary treatment modality was experimented in India only, and it was given to the world that not just in the TB asylums, the patient has to be treated away from sanatoriums were there built up for the TB treatment, but it was decided no, we can treat at home also. So the home treatment is started, but the problem is started when patients used to leave in between because he has to go back in the work, and it used to affect only the poor people. So their day-to-day activities is important. The livelihood is also important. So it was a disease of poverty, disease of the cultural issues, and also the socioeconomic conditions affecting the individual. They were all part of the whole etiology. The poverty was the main. The poverty means the nutrition was the big issue. But uh, when the dots emerged out uh, in 90s onward, 1990s onward, and it was experimented in USA, and it was brought to India, and that said that if you provide the dots supervised treatment, directly observed treatment, short course, uh, if every drug is given under supervision, then the compliance is improved. So focus again was on a compliance, and it can be miracle to the patient. uh, and in 1997 onward, we had this dot after good experimentation in India. And at the national level, we had the revised National TB Control Program. And by the dots, the dots component were very good, that political will is required, the financing, and then total duration of treatment should be given to the patient. It is secure, like the each patient has the box identified, so the name of the patient was written, and this fixed dose stripped you know treatment was available with the dot center, and it was given to the patient. So that was a new strategy and very promising strategy. But from the very beginning, uh, the experts were trying to say that the large number of patients are coming to private sectors, and they are not involved in the government sector. So if you are providing the dots, it is not necessary that the the TB is going to be managed or maybe controlled. uh, there are many studies showing in India and abroad also that almost more than 100 types of regimens used to be given by the different types of people. So this was well known to the planners, and that is why the dots came, and they just stopped all other type of regimen. uh, but the private sector was not under control, so private used to still giving different types of regimens. And so different types of regimen means that it is not a standardized treatment, and some people used to give only 3 months, 4 months, or 5 months. Some people just one or two drugs for many years. So that kind of understanding of different types of specialty, like the orthopedic, or maybe gastroenterologist, or you can say pulmonologist, they have a different types of experiment on TB. That is why they used to give different types of regimen also. So because of that, the emergence of the uh, the drug resistant TB came out, and from the very beginning we were seeing that some emergence was there, and the reason could be that we were not treating the patient uh, in a standardized manner, and the compliance was poor. Then their genetic component of the individual, also the way they are infected, like if the infection is from the resistance case, uh, you are going to have the resistance. So diagnosis was only sputum, and the diagnosis was also like, it has a very nice history. We used to have the three sputums, but later on it was turned to two. So the specificity increase, when you have three sputums, but when you decrease to two only, then definitely specificity decrease. So in that case also we missed many. And I've calculated in my book also that uh, you know how the non-involvement of private, and based on our diagnosis on the people who are coming to uh, our centers, only the passive detection of TB, uh, and then the direct observation. So all these three are bound to have large number of people not coming under the program and lead to uh, you know multi-drug resistance TB. So now we have a lot of multi-drug resistance TBs, and even the rifampicin and INH. So today we are talking of this elimination program, and saying that ending the TB by 2025 is a good move. And it's the mission which the government has given so high priority. Like the political will is there, and then money is there, then you definitely achieve a lot. And the diagnostic facility improved, the understanding of TB is also improved. So the many factors now evolved, and they have come under this program. So we are very hopeful, but target is definitely very very difficult one, and still we should try and achieve, because we will definitely reach to some place. So after 2025, I think uh, if something is left, we can achieve within 1 or 2 years. So that way, I'm very happy, and I think it is good for every public health person that TB has been considered as a big issue and problem, and lot of interest has been generated throughout the country.
Sir,
So
it is indeed very admirable, the program of elimination of TB by 2025. But one thing is there which I feel, sir, that isn't it a very short duration? Like as you rightly saying that there are issues of multi-drug resistant tuberculosis. There are issues that different doctors, different field of specialty doctors start their own experiments with the TB. They see that some patient recovered with only three drugs, so they'll not start the four drug regime. And all these kinds of things are happening on the part of medical professional as well. And if you see on the part of government as well, that grassroots level of delivery of these dot center and working of condition is not there. So 2025 isn't it something like we are right now in 2023 March, and also that the COVID can come anytime, and then the entire healthcare setup works only on that. So is it more admirable rather than achievable? Is it going to make any positive change by 2025?
yeah, Dr. Roshan, we have found that a war can be won when it is in the in a mission mode. So that is what I have learned over a period of time. Although I'm quite pessimistic on many things, but in the strategy which has been becoming the national strategy for ending the TB, and it has been accepted by the you know by the government. It was started in 2017, but the national TB elimination program was gear up, or the name changed in 2020. So we had 5 years, but on the same year we had this COVID. We rightly said that because of the COVID, 2 years there was a dip in case detection, and it was all locked. Everybody knows. So we can say that 2 years definitely big jolt, or maybe a big uh, you know obstacle uh, in that whole momentum. But what has been observed in recent report of 2023 of this TB division of the government, then that is showing uh, that in 2022 the case detection has increased almost 13 to 15%, so gone up. And they said it's a detection because of the uh, efforts by the program, or because the number of cases were piled up and they were not able to get detected during the COVID and gone up. Or maybe there are many reasons of the COVID itself, which has made the people more susceptible to tuberculosis. So these all things are there, and maybe I think not only 23 and 24 will have more and more cases, but do we have capacity to diagnose all these patients and put them on treatment? That's a most important part. So it's still many places we don't have 100% coverage, and if we can this year, if we can reach to that 100% and put all these patients detected and put on treatment. And the best part is we have the preventive tuberculosis treatment, which is again a very important part, that contacts of the TB can also be put on treatment. So, although it is very less today, but if we can put all these patients, not only by treatment, but maybe I think through many various methods like the vaccination, which may come anytime. The experiment is also going. So, if you have a vaccine treatment and the in the ARI, that is the annual risk of infection. So if we can put on treatment and we can stop that transmission, I think we can reach to some level. But you rightly said that it's a very short period. 2025 is really becoming a difficult target for everybody. Uh, Workers, although it is a vertical program and we have the dots, but ultimately at the grassroots level, these are the ashas and the workers which are looking after this program. They are also involved, rightly involved, but they have a lot of work. So other program is going to suffer if total focus is given to the TB. So yes, plus minus we can say, but we should be optimistic and try that in 2025 how much we can reduce. And if we can uh, you know make the curve going down, uh, particularly in case of the infection rate, you know uh, which is still at 33%, which is quite high of the population. So if we can decrease that one, I think rest of the story will become a success story if we can slide it down. But the infection rate is not gone down. That's a very big problem. We are finding that for last 5 years, the infection rate is almost same. It has not affected. So we have to develop more and more innovations, and that should be the part of our program also. That how much we are giving, efforts in more innovations. But besides that, I really want to say that TB is not just a medical issue, but it's a social issue. And what has been found out that if you look at other countries like West and America, as the development goes up, for last 200 years, the continuously the TB was going down. So it is of nutrition, overall development, your air, your living standards, they are all affecting the TB infection rate. So the country is going to benefit if the overall development occur. So other sectors should also play a role in overall improvement of the factors which are responsible for not only TB but other risk factors of respiratory and like diabetes and HIV, and these things should go down. Otherwise, you know, we don't think TB is going to be eradicated totally from the country.
Yes, sir. Obviously, sir, but when there is a will, there is a way, there is political will, and there is money. So I think that it will improve a lot by 2025. May not, that is very true, which you are saying, that unless and until the infection rate goes down, we cannot actually say that it is going to get eradicated anytime soon. Thank you so much, sir, for giving us time on a Sunday. You are busy the whole day, and early morning I have taken your time. I am very sorry again, and thank you so much for
Well,
joining us, sir.
it's a nice to talk to you, and you have taken up very nice topic. Uh, Now the message to all the doctors is, if we can sum up, because we have discussed the issues that it is going to be there, not there. The confusion should not be there. The doctors are always a role model for the country, and they should play a very significant role. They should have belief uh, that this is possible. As we have done it in leprosy, we have done it in yaws, we have done in smallpox. Similarly, we have done to the polio. So they should have faith in medical science. They should have faith in themselves that everybody's efforts can be a great push to the achievement of this big goal of the country. The TB, if we don't have TB, I'll tell you that our economy will go up. We can utilize that whole money to the current issues of healthcare. The quality of healthcare can improve. Our diagnostic has improved a lot, so that all diagnostic which were there, the CB NAT or the NAT, actually you will realize that when the COVID came, the COVID was able to be diagnosed by the CB NAT, and the NAT were used. So if we develop the infrastructure, it is available for all kinds of disease to diagnose and treat. So one should have believe in and should work on it, and believe that yes, uh, it is not individual affair. Or if you think that yes, dots with the daily regimen, which is now more flexible, uh, rather dots, which was there every alternative day, was not accepted by many of the experts. But today it is daily regimen, and there is a lot of flexibility, and the involvement of private sector with their incentive is there. The incentive for everybody is there. So one should not feel that why I should work. So private people, if they are involved, which is 70 to 80% of the population goes to them, we can definitely make a dent. So um, all the health professionals and people have to join hand to eradicate this disease, which is a lifelong, or maybe you can say history is there. So we can change the history by these efforts. So it is request and also appeal for everybody, and I'm looking forward their involvement in this. So, Dr. Roshan, it's a great opportunity for us that you have given, and I'm grateful to everybody.
Thank you so much, sir. Thank you so much.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.